Imagine waking up one day and finding out your heart is on the right side of your chest. Your liver is on the left, and even your stomach is in a mirror position. It sounds like something straight out of a science fiction movie, but this rare condition is very real. It's called Situs Inversus, and today we're going to explore everything about it, from how it develops to how people live full, healthy lives with their organs flipped. Situs Inversus is a congenital condition, which means people are born with it. In simple terms, it's a mirror image arrangement of your internal organs. All the major organs in your chest and abdomen develop in the opposite place from where they normally are. According to medical studies, only about 1 in every 10,000 people worldwide has this condition. It's incredibly rare, but for most people, it's not dangerous at all. In fact, most individuals with situs inversus don't even know they have it until they get an X-ray, CT scan, or ultrasound for a completely unrelated reason. So, let's break down the different types. The most common form is called situs inversus totalis, where all the major organs are completely reversed. For example, the heart is on the right side instead of the lefted condition known as dextrocardia. The liver, which is typically on the right, is found on the left, and the stomach and spleen, normally on the left, are on the right. Everything is a perfect mirror image. Then there's a much rarer and more complex type called situs inversus with levocardia. In this case, most organs are reversed, but the heart stays on the left side in its usual position. This arrangement is often more serious because it's frequently associated with congenital heart defects. There's also a related condition called heterotaxy syndrome, or CSA's ambiguous. This is where the organs aren't in a complete mirror image, but are arranged in unusual, sometimes disorganized positions. People with heterotaxy often face more significant medical challenges. You might be wondering, how does this even happen? Well, it all goes back to early fetal development. The body has a very precise left-right blueprint that tells organs where to form. In situs inversus, this blueprint gets reversed, often due to genetic factors. It's usually inherited in what's called an autosomal recessive pattern. This means both parents have to carry a copy of this specific gene, but they likely won't have any symptoms themselves. Scientists have identified several genes responsible for this left-right patterning, and if these genes don't work correctly, the organs can develop on the opposite side. It's fascinating to think about it as if your body is following the exact same instructions, just in reverse, and everything still fits together perfectly. Now, what about symptoms and health effects? For the majority of people with situs inversus totalis, there are no symptoms at all. Their organs function completely normally, and their life expectancy is the same as anyone else's. But there are exceptions. About 5 to 10% of people with situs inversus have some form of heart defect, like holes between the heart's chambers or abnormalities in the blood vessels. Another important connection is with a condition called primary ciliary dyskinesia, or PCD. PCD affects tiny, hair-like structures in our bodies called cilia. These cilia are responsible for moving mucus and fluids, especially in our airways. When they don't work properly, it can lead to chronic respiratory infections. When someone has both PCD and situs inversus, it's known as cardiogenital syndrome. People with this syndrome often experience frequent sinusitis, bronchitis, and other lung issues. But even with these potential complications, modern medicine allows people with situs inversus and related conditions to manage their health and live full, active lives. So how do people find out they have this condition? As I mentioned, it's often an accidental discovery. It usually happens during imaging tests like X-rays, CT scans, ultrasounds, or MRIs that are ordered for something else entirely. The discovery can be a huge surprise for both the patient and the doctor. This is where awareness becomes crucial, especially for diagnosis. For example, the classic symptom of appendicitis is sharp pain in the lower right abdomen. But for someone with situs inversus, that pain would be on the lower left side. If a doctor doesn't know about the organ reversal, it could lead to a serious misdiagnosis. The good news is that situs inversus itself doesn't require any treatment. The organs work just fine where they are. Instead, doctors focus on treating any associated conditions. For example, heart defects might require surgery to correct. Respiratory infections linked to PCD are managed with antibiotics or other therapies to keep the lungs clear. For people with situs inversus, the most important thing is simply awareness. It's vital that their medical records clearly state their condition. So, in case of an emergency or a planned surgery, doctors and surgeons can take the necessary precautions and plan procedures safely. There are some truly fascinating stories and facts about situs inversus. There have been several famous cases throughout history, and some individuals went their entire lives without knowing, only for it to be discovered during an autopsy. For modern imaging technology, that was often the only way it was found. Despite having their internal world flipped, many people with situs inversus have excelled in sports, built successful careers, and lived completely normal lives. Just think of it like a mirror world inside your body. Everything is reversed, yet it all still works in perfect harmony. In the end, situs inversus is a rare and amazing condition that shows just how adaptable the human body can be. It's a powerful reminder that even when things are flipped upside down, or in this case, inside out, they can still function perfectly with awareness, proper medical care, and the advancements of modern medicine. People born with this unique internal map can live long, healthy, and fulfilling lives. It's just one more example of the incredible diversity and resilience of the human body. If you found this exploration into situs inversus fascinating, please give this video a like, subscribe to the channel, and share it so more people can learn about the wonders of human biology. And if you or someone you know has a rare condition like this, we'd love to hear your story in the comments below. Thanks for watching, and we'll see you in the next video.